Hello, friends. I'm back. A nurse in the kitchen. A nurse who has not been in the kitchen for a while. Oh my gosh. I just thought I would come on today and share with you my experience with COVID-19, my COVID-19 journey. For those of you, I have not been cooking, and there is a reason for that, which I will explain in another video. Truly, I will this time. Because a lot of things have changed and I feel comfortable sharing with you why I had not been cooking. You're looking at somebody who, yes, has recovered from COVID-19. I wanted to walk you through what happened and how I recovered. It is not my intention to be political in this video, even though unconsciously I might say something that might sound political, but I do want to make a statement before I get started. For people who say this is a hoax, there is no COVID-19, well, I'm here to tell you I had it and I survived, so that's a good thing. And it is true that we have learned a lot more about how to manage COVID-19. But you just never know. Are you going to be the lucky ones who recover? Or are you not going to recover? There is no standard. We don't know. So again, I want to make that statement that yes, COVID is real. It is not a hoax. Okay, you guys know I've been working in a long-term care facility. I had stuff going on during the week, so working weekends, 16 hours was what worked for me. That's the position that I accepted. But understand that when you're working 16 hours, and especially someone like me who's a workaholic, I just take a break, like a 30-minute break between shifts, and that's it. So the whole time I'm in the building, and I think that's probably one of the reasons that possibly that I got infected. A lot of people work in this facility. Some people have tested positive. Some have gotten sick. And only one that I know of had been in the hospital. A lot of people are positive, but they have no symptoms. And they run the gamut of the age span. So it's hard for me to say that it is, the younger one or the older ones. On September the 11th, which was a Saturday, as I was completing my 16-hour shift, like maybe around 10 o'clock, because I work like 7 a.m. to 11 p.m. About 10 o'clock or so, I started to feel chills. Real chills. And I was like, oh goodness, I don't like that. So I'm getting a wrap, I'm getting my jacket. And then I remember this nurse who had recovered from COVID said, no, Miss Maggie, don't get sick. Well, I don't want to get sick. So when I got home, it was like a long night. I got home around 2 o'clock. I took my temperature. It was 100.3 or 100.4. And I'm like, ooh. And I was still chilled, putting layers and layers and blankets so I could go to sleep. And I usually don't sleep well between Saturday and Sunday anyway. So in the morning when I got up, it was a 101.5. I never have a fever. So I knew something was going on, and I was still chilled. And my facility was doing COVID testing every 2 weeks, and it just so happened that Sunday was the day that they were going to do the swab. It was a mouth swab. So I called the person responsible. I said, I have symptoms, so I'm gonna come in and get a swab, and we did. So that was the 12th. On that day was not a good day. I felt bad. It wasn't muscle pain. I never had muscle pain, but I had this pain in my hip that would run down my leg. As a nurse, you're thinking sciatica. I never have sciatica. But then he would go into my knee, and my knee would be really sore, and then he would go down my legs. And I was like, well, this is different. So with the fever, I kept taking some extra strength Tylenol. I can't tolerate a leave or anything like that. So I would sweat it out, and then it would come back again. So Monday, Tuesday, I dragged myself around the house, just on the couch, just no energy, just feeling yucky. I just don't know how else to describe it. I am not somebody who gets the flu. So the last time I remembered having the flu, I was like maybe 20, 21. So I don't know. When people say you feel like a truck ran over you, it wasn't like that. It was just a sense that there was something in your body that's just not sitting right. So Monday, Tuesday, and by that time it's like you're not sleeping, you're not eating. I try to drink to stay hydrated. And I remember on Monday, my cousin is an NP, so I said, I've heard that if you take Zithromax, zinc, and vitamin D, that might help get me a prescription for Zithromax. So I got a Z-Pack. I started taking it, didn't touch it. So that was Monday, Tuesday. So Wednesday morning, check my phone. I got my results. I'm positive for COVID. It was one of those through the night. Usually it's like 2 days, but this time it went up until the third day to get the result. And it was like, okay, what if it's positive? What if it's negative? It could be the flu. It could not be the flu. But in the back of your mind, you're thinking, it's probably COVID. So when I got the positive diagnosis, I started thinking. I said, okay, I'm very healthy. I don't have any underlying condition, diabetes, asthma, high blood pressure. I don't have any other. I don't smoke, never smoked. The only risk factor that I have is that I am an aging person. I'm in my early 60s. So that's the only risk factor that I had. And I have to tell you that I, as a healthcare professional and a citizen in general, I followed all the rules. I wore my mask. I washed my hands. I wiped surfaces. The only thing I could think in hindsight was maybe I did not change my mask often enough. At the facility, if you work on the COVID unit, you change your mask every day. But the rest of us, we don't have that luxury. But I could have changed my mask because I'm only there 2 days a week. I could have changed the mask Saturday and Sunday. I didn't do that. I don't know if that has anything to do with it. So the other thing I could think of, my facility, there were some staff members who had tested positive, as I said, had been asymptomatic, no symptoms. But in the wing where I usually hang out, supposedly we don't have COVID patients, but we do. Because every week or so they would test people and they would be positive. Or I would send them to the hospital, they would come back positive. So the exposure, we were all exposed. Why did I get it? I don't know. Does that mean if you do everything, you're still gonna get it? I don't know that either. Could it be that the fact that I was very careful kind of helped mitigate how serious my condition was? I don't know. So guys, when I got my diagnosis on Wednesday, which would be the 16th, it was like, okay, what do? There is really no medication you can take because it's a virus. You have to take an antiviral. So I also got Tamiflu, but that didn't do anything either. So during that whole time, the 4 days, Saturday, Sunday, Monday, Tuesday, Wednesday, 5 days, I still had a fever. My fever never went down to 99. It was 100.2, 100.3, 100.8. Depending if I took Tylenol, it never went below 100. But at that time, I'm telling you, I was just feeling so poorly. I was like, if it's a virus, I just hope it runs its course and that, I would just get over it. But I wasn't. Thursday morning, my fever went back up to 101.5. And I decided, I was calling my cousin who's doing a lot of COVID testing. I said, what is best practice now for COVID patients? She said nebulizers, a lot of fresh air, eating well, blah, blah, blah. Well, at that time, eating was like, ugh, there's nothing I wanted to eat. I didn't lose taste, but things just didn't taste good, and I didn't care for it. I didn't want to eat it. So I said, okay, why don't we do some nebulizers? And then I put on pulse ox. I checked my oxygen level. It was 88%. I was like, oh my God. So I started doing some deep breathing exercises to see if that would help. And it would go to 91, 92. But I knew then by that time something was happening. Let me tell you my symptoms again. It was the chills, the fever, extreme malaise, meaning you feel ugh, okay, and the weird pain that I had in my hip going down my knee and my leg. Anorexia, of course, I didn't want to eat. I never had a cough. I never had any congestion. But it was like in this area here, I felt like something was happening. I didn't know what it was, but something was happening. So when I tested my oxygen level, it was 88. I said, okay, with a fever, 88. I said, let me check my blood pressure. Blood pressure was 94 over 50 something. I'm like, whoa. As a nurse, I know that could mean I might be getting septic. If my blood pressure is so low, my oxygen is low, it's like, okay. My daughter who lives with me, I text her. I said, you know what? I'm going to check myself in the hospital. By that time, I was talking to my family. One of them is a PA. The other one is the NP. And they're like, Maggie, you need to go in the hospital and get yourself checked out and see what's going on. And as a nurse, you don't go in the hospital at the first sign of something wrong. You're like, oh, we can take care of this at home. So in that time, I'm calling her. I'm like, send me a nebulizer, this and that. So by about 2 o'clock, I said, you know what? Let me just go. At least in my PA cousin said, auntie, I should say, she said, why don't you just go get a chest x-ray and see what's going on? Because we just need to see what's going on. So I got dressed, got my little bag because I knew I was going to be in the hospital. I was going to be admitted. So I got my little bag. I got in the truck and drove myself to the emergency room. And I was feeling, the other sign that I had, it was a sign of imbalance. I mean, I was walking and it's like I'm going to the side. It's like, okay, something's going on. So I drove myself to the emergency room. In the parking lot, I parked in the ER parking lot, and then I slowly dragged myself through admission, told them what my symptoms were. I had my mask on, of course, the whole time. When the young men finally came to take my vital signs, my temperature was 102.1. And even then, I think it was like an hour or 2 hours, I sat there in that emergency room before I got in, which is pretty standard. I wasn't upset about that. So when I got in, got a very nice doctor. So I told him I work in a long-term care and I got COVID there. And my heart rate was like 112. My blood pressure was still hovering in the 90s to 100. So he gave me a liter of normal saline, to just bring up my blood pressure a little bit because I was dehydrated. Gave me some Tylenol to bring the temperature down. Did blood cultures. They swabbed my nose to see if maybe I had the flu, just to rule that out. But I told them I was positive, so they didn't have to do anything on me. My diagnosis was fever, myalgia, chills related to a positive COVID diagnosis. So they did blood cultures, did all kind of blood work, as you know. I think they started me on Rocephin and Zitromax IV. I got a dose of each. Then they did a chest x-ray. Then I had a scan. I had a lung scan. They scanned my whole body pretty much, from my chest down my hips. And they didn't find any clots, thank God. But the young lady who did the test, the technician, she said, oh, you got some crappy lungs. And I'm like, oh. And at that time, guys, my oxygen saturation was low, but I really wasn't experiencing pulmonary symptom at that time. I'm not short of breath. I could still walk up and down. So he came back, the doctor, the ER doc, he says, sorry, I'm going to have to admit you have bilateral pneumonia. What? Bilateral pneumonia in somebody who has no underlying lung disease? Just COVID hit me. But the whole time I'm feeling miserable. So they took me up to the room. So now I'm in isolation, of course. Everybody who comes in, full PPE. I have to say that the nurses were excellent, were really good. I just had one little tiff with one CNA, but I talked to him, or PCA, and then he kind of turned the corner. So the next day, infectious disease came. He talked about, they still had me on the Zithromax and the Rocephin, so I think I had another dose of that. Then, was it a pulmonologist? Oh, they also were giving me albuterol. That didn't do a thing. Not nebulizers, because they're not doing nebulizers, but inhalers. That didn't do anything. So one of the specialists, I can't remember if it was infectious disease or the doctor who was responsible for the floor, was on call. No, actually it was the infectious disease doc. My SATs were hovering between 93 and 95 on room air. But I was sitting in bed, and then the next day I got up and I sat in the chair most of the day. Could go to the bathroom, but just like woozy, dizzy, feeling bad. Oh, the food. Every time I just lifted the lid, it was like, ooh. I don't know if the food was bad, but it tasted bad to me. Really bad. So she would make me walk from my chair to the door and my SATs would drop. So she's like, I don't like that. So I'm going to start you on remdesivir. Are you willing to take it? I said, yeah, I'll take it. So they gave me a dose that Friday night. And the next day she comes back, did the same little exercise, and my SATs were still going down with activity. She's like, I'm going to keep you. So I had a second dose on Saturday. When she decided not to discharge me Saturday, she said, I want you to get one more dose of remdesivir. So I had 3 doses of remdesivir. So Sunday when she came, she said, okay, let's try. I said, I'm going home. I said, sitting here in this hospital, and the hospital was so cold. By that time, my temperature had dropped down, but on Saturday evening, it went back to 99.9. And I think on Sunday morning it was, anyway, it went to 99.9 one of those days, and then it went back down. So I was having a little bit of myalgia, so she gave me some Tylenol, took care of it. So on Sunday I said, yeah, I'm going home. She said, oh, that's definite. I said, yes, ma'am. I said, sitting here is not going to help me. And I said to the nurse, let me try a pulse incentive spirometer, which is the little thing that you have and you suck it in to expand your lungs. As nurses, when somebody has surgery, we give it to you so that you don't have pneumonia. Well, I already had pneumonia. And I wanted to bring it and show you. But when I sucked in, I could barely get to 500. That's how bad my lungs were. Normal is like 2,000 up. 500. I could not take a deep breath. It was like something just stopped me. But my pneumonia was, I think it says upper lobes. It wasn't in the lower lobe, it was in the upper lobes. Because remember, I kept feeling this thing here in the upper chest area. So they discharged me on Sunday. But I want to tell you, they said, you need a wheelchair? I'm like, no, I don't want a wheelchair. I'm going to walk. I had my bag on my shoulder, and I'm walking with the young man, the PCA. He's taking me downstairs. Let me tell you, I almost passed out because walking to the elevator with the mask on, I felt like I was being smothered, and it was like, Oh my gosh, it was scary. I did not want anything to happen to me in the elevator, so I would scare that poor child. So I slowly made it to the ER and I sat down because I'm looking at my truck in the parking lot and it was raining, so that was a good time for me to sit there. So finally I got in the car, drove myself home. And so that was Sunday the 20th. Sunday, Monday, Tuesday, Wednesday, it was like just fighting this beast and trying to use the spirometer to increase my lungs. I would get to 750 and I would have to stop there. It took me maybe a week to get to like 1500, where the lungs were starting to expand. I remember before I went to the hospital, I had an episode of diarrhea for one day, but I never had any nausea or vomiting, never had any headaches, never had any cough, never had any runny noses, congestion, nothing like that. I've never coughed anything yucky, never, even to this day. That's different, right? Because when you're assessing somebody's lung, you have a cough, you say, okay, what color is sputum? No sputum production for me, none. So, recuperating at home. So I came home on the 20th. I have to say it took about a week for me to start feeling a little bit like myself. And I have to say my family was pretty concerned. So we were like in a group chat and everybody's checking on me. How you feeling now? I mean, it was touch and go for a moment there. Not really touch and go, but just, I'm never sick. I am a healthy person. I am never ever sick. And for this virus to just hit me with a double pneumonia is just insane. Okay. So right now I'm feeling better. Thank God. I remember the first day I got in the car and went to Walmart. You just feel like I was in the twilight zone, just really spacey. People talk about some long-term effect of COVID. I don't know if it's going to be long-term. For a few days, I had this weird headache. It was like deep inside my skull. It was not like a regular headache. So I took a couple of Tylenol. When it came back, I said, you know what? If it's going to be a chronic thing, I guess in the morning, I'm going to take a 500 milligram Tylenol and be done with it. I haven't had it for a few days now, so I am very grateful. My appetite has slowly returned. My taste buds are slowly returning. But still, the stuff, that I love to cook, like fish and a salad, I'm not into it. I don't want it. So I remember we'd go call delivery, Pizza Hut, I'd try some wings. And as soon as it came, I look at it, it's like, I don't want it, right? I had one episode of GI bleed in the hospital. They gave me one shot of Lovenox. I went to the bathroom and the toilet bowl was full of blood. So I was like, okay, no more Lovenox for me. So now I'm allergic to aspirin and Lovenox. No blood thinners. Let's see. Side effect, the balance issue. My balance is still not what it should be. I worked out for the first time today, did one of my videos, and I did okay. I worked in the yard yesterday for a little bit, and then after that I crashed. So you have like these peaks and valleys where your energy just goes, so you don't know when it's gonna happen. So now I'm gonna retest myself tomorrow, which is gonna be a good 14-15 days post my first swab. So hopefully I'll be negative, because to go back to work, not to my old job, I need to, I want to make sure I have a couple of negative tests. But unfortunately, my daughter who lives with me tested positive. And let me tell you, we were careful. She has her own little apartment, outside in the courtyard. We were never around each other. We were like really separated. We wipe surfaces, we wash our hands. Well, you know, she's doing a clinical somewhere at the clinic. She could have gotten it there. I don't know. But she tested positive. But her symptoms were she just kind of got knocked out one day and slept for like 13 hours. I was like, oh, that's not good. That's not normal. She had like a little grade temp. But her biggest thing has been nausea and the taste thing. But she thankfully is feeling better. So to go back to her clinical area, she needed 2 negative COVID. So she did 1 rapid that came back negative. The next day she went back to do a rapid, it came back positive. So you can still have some false negative COVID. And yes, you can be infectious and not have symptoms. So I think I got infected, let's say on the 11th, I had the temperature. I think the weekend prior, which was the 3rd and the 4th or something like that, that's when I probably got exposed. We did have several patients who were demented, who were confused, and I had to keep them close. I mean, I don't know. I really can't pinpoint. Most of us can pinpoint how we get it, unless we are exposed to somebody in our family who has it, then we know we got it from being around them. So all I can tell you from my experience with COVID, it is not a hoax. It is real. It is a nasty, nasty virus. Everybody gets attacked differently. You can't really pretend how it's going to attack you. The complications of COVID are, you know, you have the pneumonia, and then it starts affecting your organs. There is a high risk of clot formation, either in your brain where you can get a stroke, or in your heart where you can have a heart attack, or you could have a DVT in your legs. Some people get brain fog afterwards. I think mentally I'm okay, thank God. But we just never know. There was also a sense of smell that was kind of weird. I kept smelling something burning and it was very dry. My daughter smelled like she was around the beach and there was some nasty moss. It was weird. We don't know what happened. But this virus is not to be played with. So I'm going to be continuing to do all the precautions. I'm going to wear my mask. I'm going to wash my hands. I'm going to social distance. You do you. If you believe it's a hoax, it's not real, nothing I can tell you. Everybody has to make up their own mind. But I think as a society, we are supposed to care about each other, and we are supposed to protect each other. So if I can protect you with my mask and everything else, I'm going to do it. Now, am I immune from COVID from now on? You know, the data is not there to say yay or nay whether I have immunity. There are some cases where people got reinfected with a different strain. That's what happened with viruses. They change over time. And I also did get Decadron. I did get the anti-inflammatory medication that people are talking about in the news right now. So I did get, but I got it for like maybe the 3 days I was in the hospital, and they did not send me home with anything. So I got 3 doses of remdesivir. I had Decadron and some Tylenol, and that's the only thing. I had 1 shot of Lovenox, and that was it. So guys, you're looking at somebody who has recovered from COVID. I am grateful to God and to friends and family who cared about me, who worried about me. I can't say that about my job, but as a healthcare professional, as a frontline worker, please protect yourself, because you never know when you're gonna get infected. And when you do, you're just gonna pray that you get through it. And if when you do get through it, you're just going to raise your hand and say thank you. I enjoy spending this few minutes with you guys. I just wanted to share with you my COVID-19 journey and telling you that I am back. In next video, I'm going to tell you why I've been MIA for a while. There is a reason for it. Thank you so much. I love you all. You know that. And I look forward to seeing you around in the community and on the videos. Bye, au revoir, à la prochaine.